I'm going into a specialty that is only scrubs, so I can wear scrubs every day. I can wake up and not have to think about what I wear. White coat is great, but like, I'm kind of lazy some days. Like, having to get all dressed up like this every single day seems like a hassle. I just want to wake up and wear scrubs. Is that too much to ask? So as a second-year med student in an accelerated curriculum, I have about 6 months, well now less, to start preparing to go to my clinical rotations where we're like actually somewhat student doctors. And with that, they're starting to offer a lot more simulation type stuff. So this week I have the awesome opportunity to be able to work with some pediatric residents here and kind of sit in and join some of their simulations of, actually, I'm not sure exactly what we're doing today. They said a variety of procedures, and I know in the past sessions of these, they've done lumbar punctures, they've done lac repairs, some places have done intubations, which is kind of cool. So that's what I'm heading to right now. Since we are working with residents, we got to be prim and proper in our white coats. Not sure if I'll be able to show you guys anything, just because I am working with residents and not just students. So if I can show you something, I will. Overall, that's just a pretty central theme of like what these next couple months will entail. It's all just boot camping us to hit the wards, which is really exciting, but also somewhat terrifying, just because you go from like the responsibility, oh, you're a med student, you don't really know anything, to as a second year, they're kind of expecting you to know stuff. Which like you do, but it is kind of scary because it's a lot of responsibility shifting on you very, very quickly. So it's an exciting time, a lot of fun things, but very, very busy weeks. No pressure, you're on video.
If you want a chair, that makes it easier.
So when I go in my
I'm just gonna lay down. I'm just gonna lay down right here. So I think in some shape or form, you're gonna feel like you know nothing at one point in med school. Like I said earlier, they're starting to incorporate a lot more simulation type deals to really amp up getting us prepared for clerkships at the end of the year. With that being said, I got to work with another standardized patient today complaining of headaches, abrupt onset. It was most likely a cluster headache, but what they did differently today was they had us do an oral presentation to our preceptor, which we unless you've worked in a free clinic, haven't really done before. Fortunately, I've worked in a free clinic, but that didn't make it any less daunting. But I really appreciate it because that's 99% of what we're going to be doing on rotations for the next year. But it was also kind of funny going from the pediatric simulation stuff, which there's a couple things I couldn't show you because I was in the simulation, where there were emergency cases. Say it was a 2.5-year-old with opioid overdose. And so they're coming in and going, all right, what's your initial, primary, and secondary assessment? And me and the other M2 sitting in the room were like, what? And so when you see the resident or intern resident struggle to present to their attending, it's really terrifying looking at us going, you know, we still have a couple months left, but shoot, we're supposed to get to that point, which I know we will, but I don't think there's ever a time when you feel 100% confident. All you can do is work to be as prepared as you can, and that's why you have a team of awesome attendings, nurses, etc. to help you out, and really appreciative of that. But yeah, things are starting to ramp up. I'm in this white coat a lot more than I was in my first year. Oh, I don't know whether that's a good or bad thing. Just got back from Best Buy too, and I picked up a Polar Pro, like Polaris filter. It's supposed to kind of soften the digital edges. I'm gonna nerd out camera language for a second. Not sure if this actually makes a difference, but I've been filming on a prime lens for the past couple weeks because the lenses that I need for vlogging back order on every single site. So let me see if you'll discover with me if this makes a difference. The red is on. Hello. Focus. Technical difficulties. Okay, cool. We exposed? Kind of underexposed. All right, how does that look? It's supposed to like soften the edges a little bit, get some saturation back. Is it variable? Oh, it is variable. Oh, wait, that's so cool. So, turn it this way. You can see there. Look at it polarizing. I'm just twisting the lens. It's almost like an ND filter, but more to soften things. I don't know if it makes a difference. I'll probably look at this in post and see what it looks like. New toys. Gotta figure out all these lesions by tonight. Yep, gonna be a long one. Obligatory post-quiz review. What'd you think of this week? What'd you think of the quiz? If you don't have anything nice to say, don't say anything at all. All right, that sums up the quiz.